I'm Chris Tudan. I'm the Director of Quality Assurance at Velocity Labs. As a consultant before joining Velocity Labs, I've been helping to support the animal health industry for a good number of years, and also working with Debbie Garvin in that regard. There's quite a history behind the ICH M10. So the 2018 guidance was issued following the 2012 EMA guidance, and there was a lot of discussions that went on globally with regards to trying to harmonize the guidances between the EMA guidance and the 2018 guidance. And that's where the M10 came. The EU had endorsed the M10 before the US did. The US did in November of 2022. The CVM, they endorsed the 2018 guidance and made it part of their a guidance for industry that they had, GFI number 145, and that's what they've been following. And when the M10 came out and it wasn't endorsed by the CVM, it started to pose challenges in the sense that there weren't experiments in the 2018 guidance that were required in the M10 and vice versa. And so from a workflow perspective, it made for a challenge, because one, of course, needs to facilitate what the CVM expectations are, but when you're adopting the M10 with different experiments and different expectations with those experiments, it becomes a challenge. You have to change your workflow. The M10, in terms of documentation, is more similar to what the CVM expectations are versus the 2018 guidance. And the documentation with the CVM is far more, there's far more requirements than with human health. And so we were glad that the M10 was endorsed, because the M10 facilitates the documentation requirements more than the 2018 guidance. The challenge that they were having primarily was with the contract research organization, the bioanalytical CRO. The CRO had made the transition from the 2018 guidance to the M10 guidance and had adopted their workflows in that regard. And so there was a number of CROs that were either reluctant to validate methods following the 2018 guidance, or were concerned about the best approach and what the CVM's expectations would be, because they still wanted to follow the M10 guidance, in that some of the experiments within the M10 guidance are more scientifically sound, if you will. The challenge was really working with the CRO. Some didn't want to adopt the 2018 guidance and supporting the animal health industry. And the other area of concern was the animal health industry is different from the human health industry in the sense that supporting an application is in a phased approach. So with animal health, the CVM has to accept the validation before the company can proceed to sample analyses. And so that validation is highly scrutinized. The documentation is different. And so the bioanalytical facility sometimes had to be very flexible, if you will, in terms of supporting the animal health, and especially with regards to the increase in frequency in which the CVM wouldn't accept the validation. And so the CRO would have to accommodate that. Considering the advantages of the M10 guidance, I started dialogue with various people, including Ben Moses, who is part of DECRA. And I had asked him if he thought it was valuable to try to facilitate a change within the CVM and how I might be able to do that. And that's when he suggested I do it through GATA. We were all really surprised. When I started the initiative, colleagues in the industry said it would take a couple of years. And we thought it would take a long time, because usually when you're trying to get the CVM to make any changes in regulations and processes, it is a process in itself. So the first step was presenting the idea, the rationale and defense to the CVM, which we did in February. And they were quite receptive to that. And following that meeting, that they said they would they would consider it and recommended that we put together a white paper delineating what we had argued during that meeting in February. And so I put a white paper together and presented that to the CVM. And I guess the meeting itself in February was quite convincing, especially in terms of introducing the challenges that the industry was actually having, and they may not have been aware of that. And so the meeting that we had in June, they came forth and said that they were going to endorse the M10. In fact, what they said is they're going to endorse both, which makes sense because they still have their GFI 145, which is the 2018 guidance, but they said that they would endorse both, which was quite a breakthrough because it was so rapid. And I think that not only was the animal health industry relieved, but I'm sure that those CROs that are supporting the animal health industry were quite relieved, as were we. I've been supporting the animal health industry as a consultant for a significant period of time and working with a lot of companies, sponsors within the animal health industry. And there's a number of challenges that they have in working with the CRO, regardless of the impact of the M10 guidance. But it's going to change the workflow. And I'll give you an example. Before the M10 was endorsed by the CVM, at Velocity Labs, we had our own SOP describing the process that we would take to support the animal health industry in a manner that the applications would not be challenged by the CVM. And in fact, what we were doing, we're conducting experiments both from the 2018 guidance and the M10 to ensure that there's even greater scientific integrity with the data. Now in that we can follow the M10. Our SOP has evolved to support the M10, but to maintain those requirements that are necessary for the documentation, the differences that still exist between animal health and human health. I think that it's going to be easier for the CRO and hence for the animal health industry if they're working with the right CRO. So oftentimes, because the animal health studies tend to be smaller than the human health studies, the CRO tends to push out the animal health studies in terms of when they're conducting the sample analysis, how long it's taking for them to complete the method validations. And so in the industry, one might have to wait months to get your study conducted, and usually the animal health industry is on the tail end of that, ensuring that you can get your studies conducted in a timely manner, not having to wait for months, if you will, has a huge impact because the timelines with animal health studies tends to be a little bit longer because of this phased approach that you have to take. For instance, where the CVM has to accept your method validation before you can proceed with your sample analyses. We facilitate at Velocity Labs sample analysis within 5 days of receiving all of the required reagents. So we're trying to support the industry in that regard. The other is in terms of flexibility. So because the documentation is distinctly different, where there's far more documentation that's required for animal health, the principal investigator has to be flexible in terms of the amount of documentation that is required by the CVM. And oftentimes you're working really closely with the sponsor, which a lot of CROs really have challenges doing, but you're working closely with the sponsor. You're going back and forth to ensure that the documentation is as the sponsor requires, and what they're requiring is what they believe the CVM expects. And I would say the other area is choosing a good CRO to support your animal health industry is experience. So it's not uncommon, for instance, for the CVM to not accept the initial application or your validation data or your sample analysis report. But if you have a lot of experience doing the studies, writing the reports, interacting with the sponsor, then you don't run into challenges with the CVM, which can hold back the timing of your application and getting drug to market. For the animal health industry, it comes to speed and ensuring that your studies are accepted by the CVM in this phase approach that I was talking about earlier. So if you're working with an experienced CRO that has the procedures to support your studies, including residue studies, for instance, which very few CROs are willing to accommodate, comes down to trying to enable your studies to be accepted by the CVM in a timely manner without any challenges by the CVM. And so working with a CRO that is willing to have that constant dialogue between the PI and the sponsor is really invaluable. Believe it or not, there's a greater scrutiny of animal health data than there's with human health data. And so having a CRO that you can work closely with to ensure that you have the rigor that you need to have those studies accepted immediately by the CVM is really important. I think vaccines will start to become more prevalent in animal health and for bioanalysis. Now the development of biologics being used for animal health as well, that's sort of the new area of animal health that the industry has to deal with. And so then you have to work with a CRO that can adequately measure the biologicals, if you will, in the animal matrices. We are really excited about the implementation of the acceptance of the M10 guidance by the CVM, and more than that, we're thrilled to have played a role in that. We're a company or CRO that is strongly supportive of the animal health industry, and so in order to facilitate better science, which the M10 helps to facilitate, that makes us a better CRO for the animal health industry. And so in the endeavor that we undertook, because of the excitement we have, we thought that we'd summarize the rationale behind why we wanted to support or have the CVM support the M10 guidance. And so we provided a report, and the report provides well, first of all, a comparison between the two guidances, and then the rationale as to why one would want to use the M10 guidance, and the rationale behind why the CVM should and ultimately did endorse the M10 guidance actually quite quickly. So I would recommend that the sponsors or anyone in the animal health industry to read that report, to understand the history and the advantages, if you will, of the M10. And at Velocity Labs, don't hesitate to call us, call myself, or set up a meeting so we can discuss how we can support your animal health studies further, and especially in regards to our providing experience, flexibility, and the timing that you would need to facilitate your animal drug development. So please do check out the report and be happy to be in touch.